All right, so I'm going to try and explain why the new novel coronavirus is such a big deal for the United States. So, Harvard scientists and some of the world's best epidemiologists have predicted that around 40 to 70% of the world's population will become infected with COVID 19 this year. This guy, Bruce Aylward, he's an epidemiologist and he's affiliated with the World Health Organization. He, along with all the mainstream news media, have been stating that about 80% of COVID 19 cases are mild, about 14% are severe, and about 6% become critically ill. So 20% of people will require some form of hospitalization. So the issue here is in America, the population is 327 million. And out of that 327 million, 47 million people are above the age of 65. Okay? In America, you take all the hospitals in the country, there's about 100,000 ICU beds. Okay? And obviously, they're not all available. You've got people recovering from heart surgery, etc. So let's just do some math here. So let's say 20% of 47 million senior citizens. All right? So that's 9,400,000. All right, so let's just say 6% of 9 million senior citizens. That's 540,000 senior citizens that are going to require intensive care in this country. So the governor of Washington, Jay Inslee, he has stated that according to their infection rate in that state, they predict that in about 8 weeks, they're going to have close to 64,000 infections.
Tomorrow morning. Now, that announcement tomorrow follows one from the governor early today, where he was mapping out some pretty alarming figures about how this virus is spreading in our state. He said that at this rate, we could see up to 64,000 coronavirus cases in as little as 8 weeks. Now,
okay, so that's one state. Okay, so let's just reiterate here.
Now, consider that in a month or two, we may have 1 million simultaneous COVID-19 patients, and those who are critically ill will require weeks of ventilator support before recovery. We're going to find ourselves short thousands upon thousands of ICU beds. This won't just affect patients with COVID-19, this will affect every critically ill patient. We will run out of ventilators. And even before that point, hospitals may run out of personal protective equipment, such as N95 masks, disposable gowns, and gloves.
Okay, and so China, our supply chain of medical protective equipment, because most of it is manufactured over there, they've been going through their own health crisis with this issue. So that's another reason why we're low on medical protective gear. And if you Google how many N95 masks does the U.S. have, you're just going to see articles that clearly state that there's a shortage of just medical protective equipment here in this country. So
in one area hospital, medical providers say they're being asked to reuse masks that are designed for single use only. Another facility is reserving masks for patients, and staff are being asked to go without in some situations. Multicare Puget Sound says all 6 of their hospitals are facing shortages, and they've implemented reuse policies to stretch supplies until more can arrive.
So the other issue is the testing kits. There's likely thousands of cases running rampant in this country that they're just unaccounted for and they're just spreading around. So in other words, we've dragged our feet in preventing and containing this. So now it's just all you can do is mitigate it. So the governor of New York, Andrew Cuomo, had something pretty interesting to say here.
But I think they have to increase the number of tests. Also, the deep breath point is, this is not going to end the world, you know? This is not the Ebola virus, which I went through. That was frightening. If you're a vulnerable member of the vulnerable population, you're a senior citizen, you're immune compromised, then it's dangerous. But that's really what this is about. Right?
Exactly. I mean, this is not an existential threat. In other words, humanity is not going to get infected and die off. But you can see the issue here when you run the numbers. And COVID-19 is just not, it's not a disease just for the elderly. All right, so here's an example of that.
Also, where 32-year-old physician's assistant James Kai is hospitalized. Kai describing himself as previously healthy, but the virus is taking a heavy toll.
Half of my lung is already pneumonia, not working, only half. So I don't know how much longer I have to keep my lung working.
The spread.
Okay, so, this right here, that's just senior citizens that will likely require some form of, ICU care. And that's not all the 50-year-olds and 40-year-olds and even 30-year-olds and in rare cases probably 20-year-olds. So you can begin to see the pressure that the healthcare system is going to be under in the coming weeks. So let's look at Italy here. On February 25th in Italy, they had 132 confirmed cases. All right? You fast forward to March 10th, they had 9,200 cases. And this was the process for them. They had a case, cluster, boom. And when boom happens in the United States, that's when the healthcare system is really going to be under pressure. And that's probably going to be around mid-April. So, this is turning out to be an extremely bad situation, and there are going to be a lot of people in this country that are going to be struggling mentally and emotionally, and they're having a hard time processing what is to come. And, they've already put some measures in New York to sort of quarantine off a suburban area. They've got, 176 confirmed cases. Washington's got 273 confirmed cases, and they weren't able to contain this, and they haven't been on the ball with testing. People are running around with asymptomatic mild symptoms, spreading it around. So the weak and the vulnerable are going to pile up here. And again, this is just 65 plus. So man, this could get really bad in the coming weeks. I don't know. I don't know what to think about this, but if you go through all this, this should give you a good idea of why the U.S. is going to be having a hard time with this. So